So let's start with the tool of peer listening and disclosing. This is really the thing that defines our role as peers, that we have lived experience of mental health issues, substance use, or both, and that we talk about it, that we're known to have those issues, we disclose that we have those issues, and that we try to set up relationships that are peer relationships, relationships of more equality. That doesn't mean that someone who works at Share is completely equal with someone that we're providing services to. There's still a little bit of a power differential. What are some of the ways that Share staff have more power than the people that we're serving? Anyone have thoughts on that? How am I more powerful as someone that works at Share than someone who walks in the door to go to a meeting or to volunteer?
We have your training class, Abby.
Yes, you have taken this training class, number one. What else?
You've got a job and a place to live.
Yeah, basics, you know.
Yeah.
You might have a nice cell phone and they don't, maybe. You probably have
12 steps.
You probably have keys to the storage room. You have a job title and the status that confers. So, you know, it's good for us to be aware of the ways that our power might separate us from people so that we can find ways to sort of minimize some of those differences in different ways.
I think there's something that I just want to add that's a really big factor for me is that, like, we have an awareness of our challenges. Like, we've come into acceptance and we've delivered ourselves into that surrender or that willingness and that cooperation, a relationship with a higher power, whatever that might be. Like, we have a community of resources and support group, and we've been, for the most part, restored to sanity. You know what I mean? Like, and it's like a lot of times we forget what an asset that is coming from somebody who's still in complete denial or unawareness.
Yeah. Is that what you were talking about, Janet, when you said?
Yeah, 12 steps, because I understand the insanity of the disease.
Yeah. You've said to yourself, you know what? That was really insane that I was living that way. and people who might be in a similar place they're not there yet. They don't have a lot of necessarily insight, or sometimes the insight is uneven. They might have a lot of insight in one area of their life, but have some blind spots in other areas. And that's a big difference. Like, to be able to talk about your feelings is not something that a lot of people can do early in recovery or before they get some recovery. They don't know what their feelings are.
The power of the pause.
Yeah, they don't have access to that inner world. It's like, it's mixed up in there. At least I'm talking from my own life experience, that it was very hard for me to talk about what was going on inside in a way that I now have access to that. So this is one of the things that listening and disclosing accomplishes, is that we become sort of role models for someone who knows how to do that. I know how to listen and I know how to disclose my own experience, and that shows people how to do those two things. They watch the person saying, wow, they listened to me, and then they talked about their own experience of it.